Okay, let's now dive into cutting phases. So, cutting phase, period nutrition designed to help individuals lose body fat and reduce body weight while preserving as much of a lean muscle as they possibly can. We call it hypocaloric dieting because the core principle is eating less when the body expands, creating a deficit, using fitness and bodybuilding when the goal is to get leaner, and any fat loss event. It's the only thing that really works. So, the purpose of the cutting phase is primarily fat loss. Okay, that's it. Simple as that. Now, the length of the cutting phase, that can change over time. So let's do this. Um, Duration of the cutting phase will base on the individual's fat loss goals and how much body fat they want to lose. If it's longer, they're going to need to take a little bit longer. Now, in most cases, 12 weeks is probably the most for psychological reasons, and you can get some adaptive thermogenesis, but it's not as common as what people think. Okay, it's generally more for psychological reasons. 3 months is a long time to lose body fat. The exception to the rule are people who have a lot of body fat to lose. They can generally do it for longer because they've still got stored body fat that they can actually use as fuel for their body. Now, with the structure, generally what we'll do, and this is a nice way to do it for clients psychologically, there is not much physiological benefit to this. 1 to 6 weeks at a deficit, 1 week in maintenance calories, allowing the metabolism to reset and avoid metabolic slowdown. It won't happen that drastically, but clients will still think that. And they'll have long term fat loss with minimal actual impact on their metabolic health and maintain a whole bunch of muscle retention. I use this approach with clients who may not be as psychologically well endowed for hard dieting. They may find it really challenging. They may have work requirements that require them to have a high degree of attention. So I would use these breaks more frequently with those clients. For clients who are willing and able to push through and it's really important to them, I'll get them to keep it because every week we're on a diet break is a week we're not losing fat and it drags out the process by another week. Now, how we implement it? Identify the goal. Understanding a 10% drop in body weight per cutting phase is a good target before needing a maintenance period. This is why in the last video, I said maintenance phases are the most important thing. Because if we don't have maintenance periods, what's going to happen? People are going to go back to where they were. So we calculate TDE. However we do that, in one of the many methods I showed you, or having an estimate, or getting people to track their calories for 2 weeks and see what their TDE is, and then basically get a deficit for them. And every time they begin a new phase, recalculate the TDE. Now, some of the downsides, you can get metabolic adaptation and muscle loss. Metabolic adaptation is rare. It can happen. I don't want to say it doesn't happen, but it's very rare in general population clients. We see it more in clients who go into severe, like 900 calorie deficits. 900 calories as their total diet, not a deficit. They get some of these problems. We also get a risk of muscle loss if we do it for too long, and if resistance training is not prioritized and protein intake optimized. Now, the thing with that, if you do those two things, you're generally going to be okay. So most of these issues are not a problem for your clients. More often than not, we literally just see people struggling to stick to it, and that's why it doesn't work. Now, to minimize risk, a moderate deficit and a resistance training are the best two tools to do that. A serious deficit will cause issues for a lot of people who've done for too long, but for the right clients, they're very useful, and we're going to talk about that in a future video. Now, some training considerations. Generally, when someone's in a deficit, their ability to recover will be reduced. So training volume goes down, okay? We don't try and progress sets every week. That is a valid method of progressive overload, but we don't want to do that when someone's in a serious cutting phase, simply because they won't have the tools to do it. And we think of recovery, it's not just muscles, it's also soft tissues, joints, tendons, ligaments, all those structures. So generally what I do is I focus on increasing intensity or increasing, the rate of perceived exertion closer to failure and making sure that we use maybe a little bit less volume. So in the cutting phase, 0.5 to 1% total body weight per week down. That's a really good result. Generally, the foods need to be more whole foods, higher fiber, to be higher satiation for these clients. That will help out really well. And performance and training may drop down. Now, I personally believe with a lot of clients is that's in their head. Okay, if they have proper macronutrient distribution, all that kind of stuff, it's in their head a lot of the time, and the fatigue is a mental construct rather than a physiological construct. So that's something that just to be aware of. So a quick summary of the cutting phase. The goal is to reduce body fat while keeping muscle. 1 to 12 weeks. Anything over 12 weeks is a bit much. In bodybuilding, it can be longer, but they're looking for a different level of leanness, and we're not coaching bodybuilders in this course. Deficit, 10 to 20% calorie deficit from TDEE. What we're also looking at is diet break, maybe a 1 week break every 4 to 6 weeks based on the person. Resistance training at least 3 times a week, moderate volume. The goal is 0.5 to 1% of body weight per week, and satiation should be manageable if whole foods are used. If people are really struggling, look at the food choices that they make and the other stuff that they're doing, which may be impacting their diet.